Kentucky News, October 6, 2013. So this is day 152 in the government shutdown. This has snowballed into an apocalyptic catastrophe, epic proportions.
One House Republican said, we're not going to be disrespected. We have to get something out of this, and I don't know what that even is.
So
that was a quote.
It's the President of the United States.
We're not going to be disrespected. We got to get something out of this, and I don't know what that even is. What you get is our intelligence professionals being back on the job. What you get is our medical researchers back on the job. What you get are little kids back in the Head Start. What you get are our national parks and monuments open again. What you get is the economy not stalling, but continuing to grow. What you get are workers continuing to be hired. That's what you get. That's what you should be asking for. Take a vote, stop this farce, and end this shutdown right now. If you're working here and in the middle of the day you just stopped and said, you know what, I want to get something, but I don't know exactly what I'm going to get, but I'm just going to stop working until I get something. I'm going to shut down the whole plant until I get something. You get fired.
Even a person who doesn't strike has a purpose. There's even a reason
former senior advisor to President Obama.
So that's, the President of the United States talking about this shutdown. I got lots of news things here, and I'm just gonna actually just go through them like as I feel like it. At my pace, I'm gonna try to keep a pretty fast pace. So still shutdowns going on. I had one clip about Ted Cruz. It hasn't been 150 days, it's been 3 or 4 days. And it was 20 days, like in 96 or 97 or whenever Newt Gingrich did it about, 17 years ago. And it lasted for about, 20 days. So, and everything didn't collapse, and it seemed like it was okay. It didn't spiral into, oblivion. But shutting the government down, our credit rating goes down, and there are, the WIC has been cut, and the museums and the national parks, they've been cut. Some of the National Guard, they've been furloughed, until. But actually, I just heard that the Defense Department's telling people to come back. So they could just be like, we're in a war, okay? We're in a war, and we're allowed to spend American money on the troops and military stuff because, we're in the middle of a war, and we've been in the middle of a war since 9/11. The war on terror, right? We haven't stopped this war on terror. We're still in a war on, you all realize, right? Yeah. So, okay, the government shutdown is going on right now. If you are Kentucky and you poor, okay, this is everybody in Kentucky. If you don't have health insurance, sign up right now. I was going to pull up some of the numbers, but essentially there's 640,000 Kentuckians who have no health care. So over 500,000 Kentuckians have no health insurance, and then we only got 4 million people, so that's, that's a good chunk, 10 to 20%. So 640,000 Kentuckians do not have insurance, but only 1,000 Kentuckians have signed up for it. So if you know people that don't have insurance, get on kynect.com. Kynect is what it spells out, but just KYNECT. And I put .com, and it goes to like .gov, some other thing. You can also Google that. Google Kynect, or just type it in your URL address and see if that works. But yeah, get health care. Not only will the health care help you, okay, but this is important to do it politically right now. The government shut down because of Obamacare. And Obamacare is not perfect, okay? But you don't want to throw out the good because it's not perfect, and it's a step in the right direction. The healthcare industry is a fucking mess. It's shitty. They should be passed. All these insurance companies are lowering their rates, and the problem is that it's not a public option, so it's not government health care. That's the problem. So it actually he isn't socialistic. It's not socialistic medicine. It's not socialized, whatever they were calling it, socialized medicine. It's so stupid. So it's not socialized medicine because there's no actual government health care. All we're doing is, or all that's being done is the private insurance companies are competing because in America, the competition, drives rates down. That's what we've been taught. That's what they tell us. But only 1,000. So it's politically important for Kentuckians right now to be signing on. There are a lot of people checked onto the website and it didn't shut down. Just recently, Brashear had expanded the Medicaid program over 300,000 people. So we benefit. We're a poor state. We're a receiver state. We're already getting way more, welfare than every other state out there, especially New Jersey. Chris Christie is right. So for every dollar we give to Obama, Obama gives us $1.50. So we get more money, per dollar. We get more bang for our buck. It's in our interest to make sure we get all these federal programs. And I think actually the opposite of, not austerity. What the fuck? Austerity is killing Europe. Okay? We don't want austerity in America. We don't want to be cutting things. We want more taxes on the rich, and we want more money in the hands of the poor. That's how you're going to rejuvenate the economy. So you need people that have, good health. Healthcare is a human right. It should be right for everybody to do it whatsoever. But I do believe they want to say, oh, lower taxes and it's going to raise taxes. To raise a little bit of taxes for healthcare, that's a no-brainer. Of course you want your people. If you're the king, or if you're the president, or if you're Moses, and you're taking care of your people, do you not want your people to eat? What the fuck? Do you not want your people to have health insurance? You don't want them to be healthy? That's good for the individual. It's good for the worker. It's the business owner, the CEO. It's good for everybody. Okay? It's good for everybody all around not to have a bunch of ignorant, stupid, sick, diseased motherfuckers out here. We don't want a bunch of sick, diseased motherfuckers roaming around Kentucky, okay? Let's get some health insurance. Let's raise the health status of every Kentuckian. And we're going to do it by signing up for Kynect. Sign up for Kynect. Get it. All you got to do is get on KYNECT and fill out an account. And once you filled out the account, you fill out an application, so you just put in just basically your name and information stuff you could just memorize off the top of your head, and you're done. That's it. Sign up for account, write the password and account and username somewhere so that way you don't forget it, and then that's it. Then fill out the application, just go through the windows and do exactly as they tell you what to do. It's it's important for you to do it now, but it's important politically. That way, it puts pressure on it's Kentucky. So Mitch McConnell and Rand Paul, they're fucking scaring the shit out of all of America about this shit, while Steve Brashear is implementing Obamacare, the quickest and fastest and most efficient in the entire country. So we got some real nice, cool. I don't know if it's cool. It's scary in a way, but countercurrents that's going on right now. So we need to be with if you're pro-Kentucky, if you're with our governor, if you want people to have better health, not just yourself, but everybody, sign up for Kynect, especially if you're poor. I mean, that's why this is here for you. 640,000 Kentuckians have no health insurance. 640,000. So, they said they created the exchange by executive order. Kentucky's received $250 million to set it up. So they've backing this thing with $250 million. That's so much fucking money. That is so much money. How come only 1,000 people have signed up for this? With $250 million? That's a shit ton of money, okay? And this just to set this thing up. So I'm sure the federal government will be able to they expanded Medicaid, so the federal government's going to subsidize. If you're poor, you can't afford it, you pick, I picked Passport. There is either Humana, Passport, or some other new company, which I forget off the top of my head right now. Um, and then they signed me up for Medicaid, and Medicaid, since I am poor, since I have no income, I get health insurance starting on November 1st, 2014. So not only did I sign up, I got health care for the first time. So get some health care. I think it's good for everybody. It's good for Kentucky. And there's 640. There's over 500,000 fucking Kentuckians that, if they get sick, they just gonna drink a bunch of fluids and take a bunch of naps and hope that they don't die. Like, I wouldn't go to the hospital unless I was near death. So, the nearly 11,000 applications have been completed. So 11,000, but that's still significantly less than 640,000. So 640,000 is how many people that we need to have health insurance, and this is out of 4 million, right? So we have a significant portion of Kentuckians who have no health insurance. So that's pretty much, I think, what I got from this. Premiums range from, if you are able to pay for it, they're $50 a month to more than $700 a month for a family of four. 4 out of 5 Kentuckians will be eligible based on income cutoffs for federal subsidies, which range from less than $100 to more than $500 a month to pay premiums. So we got 640,000 Kentuckians who have no health insurance, and we're in a state that ranks at the top nationally for many health problems: obesity, heart disease, cancer, lung cancer, skin cancer, all kinds of cancer. We're number one for all cancer. So we've already expanded Medicaid earlier this year. Steve Beshear has. So there's that's a positive development, right? He expanded Medicaid, so it just shows that this is a good infrastructure. It's solid. It's strong. He's expanded Medicaid to 300,000 people, so more people have already gone on to the working poor who don't have health insurance. And then the federal government's going to pick up the entire cost of the expansion for the first 3 years, and then 90% over the long haul. Why would Kentucky not do that? We're going to pay just 10% of this fucking thing. Kentuckians will only pay 10%. We'll fucking be a receiver state just like any other fucking thing. There was one article that was written, it was a Democrat article, it was a liberal that was kind of like, well, shit, you got Rand Paul, Mitch McConnell, they're sitting there saying, save money, no taxes, it's the government's fault, fuck the government, blah, blah, blah. And if that's really what Kentucky do, fuck them. Fuck Kentucky. Fuck Kentucky and just write them off, Quit giving Kentucky money. They don't give a shit. They're a bunch of fucking conservative Republicans. So they're not trying to save any money. They don't give a fuck about the actual people. Just cut them off, Kentuckians aren't appreciative of the money that the federal government is giving them right now. They didn't vote for Obama. They probably won't vote for, Obama again, right? And like, Obama has really nothing to gain. He could try to turn Kentuckians, towards, his side, especially since this is a good thing for many Kentuckians. If you know people with health problems that don't have health insurance, or if you just anybody really, any of your friends, your people your family, your neighbors, tell everybody, get some health insurance, because, it's important. It's important politically. It's good for you. It's good for everybody. Yeah. What was I talking about with the? Oh yeah, to cut them off. So if you just cut us off, if you just get the Republicans to cut us off, that means we'll have no more food stamps, no more health insurance, no more food for the kids at school, no more defense contracts, no more National Guard, no more money for the police. I mean, some of those things are actually okay in my mind, but there's, no funding. We're a receiver state. If you were to cut food stamps off, Kentuckians would starve to death. And some people are for that. Who gives a fuck? I'm not responsible for you. I'm not my brother's keeper. If you starve to death, that's on you. Get some fucking health insurance, Kentucky.